Hi everyone, my name is Karthik Singhal. I'm director with Zico Aircon Limited and also founder of O2 Cure. The point here, how COVID has impacted and added to the cocktail of air pollution, is basically the size of the virus is 0.125 microns. So even if someone sneezes or coughs in front of me, it gets a medium, the virus gets a medium. Here, PM level particles or the size of zero point 0.3 micron particles can get attached to these particles of virus and be transferred from one place to the other. So it is very important to clean our indoor space, I feel, as pollution has added over to what we are already facing. And COVID with a mixture of pollution could be dangerous. It was in the late 1960s that the world understood the problem is in the air and needs to be controlled. That is when the Environmental Protection Act came up with the National Air Quality Standards in 1971. Now this was an act that was made for the world, but every country would pick up most of the air pollutants that they have and make their own air quality standards that they would follow. China would follow their own, Malaysia and Singapore would follow their own, and India follows their own. Now what happened is that we are monitoring the outdoor air quality, which gives us a numerical value as AQI, Air Quality Index. It has multiple gases, it has the PM levels, it has microbial, so some of these bacterial levels as well. But whichever is the highest number is shown to you as the Air Quality Index value. Wherein I would like to jump in and say that we can add more pollutants as we are very high on the ozone that is getting produced. On the carbon footprint, we are the third largest producer of carbon in the air, so that is something that we can work on. Then there are certain agencies that the government has developed specifically for Delhi or regions with higher air pollution problems, where we have different air quality standard acts coming in now, where we have using technology as a weapon to control the indoor air quality and at the same time managing our other wastes that are producing the outdoor pollutants, specifically your dump yards, specifically areas which are high with vehicular emissions, having some good policies and rebates on electrical vehicles. So those are the system differences or system changes that we've seen over the years that the country has taken. But there is a long way to go as the problem still lies in the air. So way back in the 1980s, my father realized that there is a sudden boom in the HVAC segment, in air conditioners and central air conditioners. There were a lot of developments happening in the government sector as well. He realized that there is a lack of awareness in terms of the Indian market of air conditioners and Indian air conditioners manufacturer as well. That is where he started Zico Aircon in 1989, which is now the leading manufacturer for central air conditioners in India. Then later when you are into air conditioning, you also start doing air purification because it goes hand in hand. So we were doing air purification in the B2B segment, on the business segment for about 20-25 years. But when COVID hit us, or where we were facing air pollution at the highest, we realized that, or I realized that there is a big gap between what the manufacturer can make and what the consumer is aware of. Now I realize that people have started buying air purifiers on the verge of smart features that they offer. If they offer a Wi-Fi enabled system, if they offer a smart app system, if they offer something that is aesthetically beautiful that goes as a luxury in my house. But no one was focusing on the kind of air purifier that is needed, what is the air filtration that it offers, what kind of air pollutant it kills. So those were the things that I saw that it's basically turned in 5 to 6 years. I've seen that air purifiers have been converted from your medical and health category into your home appliance category. That became something of concern for me. And that is when I thought of starting with O2 Cure. With 32 years of rich experience in the science and technology of what goes behind making air purification and defining the air purifiers and innovating technologies all around the globe, I thought of coming up with our own products which are manufactured in India and can be customized 100% to the requirement of the person. If someone is suffering from a particular respiratory disease, maybe every purifier is not a solution for them. They have to know their problem in order to fight the problem. And that is where we give solutions. We started giving solutions for PM level suspended particles, for microbials, including the coronavirus, and also for toxic indoor or outdoor gases. And we started with O2 Cure, a platform that offers bespoke air purification technologies in the most easiest form, not very smart feature enabled, but yes, at the same time, our engineers, our indoor air quality engineers are tied up with our consumers. Every product that one buys from us, he is assigned an indoor air quality expert who he can reach out to any time for whatever respiratory problem or problem in the house or PM levels people have. Second, there is so much unawareness in the market that people, there are respiratory problems only with kids, there are respiratory problems only with people of senior or adults. Right? We need to understand the enemy first in order to fight it. That is where we started our research. When we talk about the technology that I mentioned about killing of coronavirus, the PHI photohydroionization technology. Now this is by my American partner RGF. It is in USA. And in the 1990s, late 1990s, the founder Ron Frink was asked that by the American government that can you come up with a solution for a bioterror war if there ever will be in future. And that is when they started their research on the PHI cell and how productive and effective it can be on any kind of virus or bacteria or microbial out there. We started testing in different labs. We tested it on H1N1, swine flu, bird flu, Norwalk flu. These are different separate virus outbreaks that we've seen in the world. And then we checked it on SARS-CoV-1, and now it is tested on SARS-CoV-2, severe acute respiratory syndrome coronavirus second outbreak, with a 99.9% efficacy in the air. Now it is very interesting to understand how a product gets tested. Either I can test my product in a small shoebox size, where I test any product and it might show some efficacy towards the virus. But what we did was we tested our product with limited air recirculation in a 1280 cubic feet box, simulating a real-time situation, wherein we tested it on the air, on the surface and also in the air, and the results were similar, 99.96 and 99.99% that we got a reduction. Now, again, so this is the most advanced technology that one can have in their houses or in their offices or wherever in the world there are to fight or mitigate the spread of this virus. Like I mentioned, the vision of O2 Cure is making people aware and educating our society that what lies in front of us, the air pollutants, we need to understand them first in order to have the right weapon against them. So in that manner, we've tied up with veteran actor Sunil Shetty, who is who wanted to promote this and market it just for education purpose, just for people to understand on different platforms how we need to incorporate air purification as a part of our daily life if we need to have a healthy life for us and for our children. Now, there's a very interesting concept that I wanted to highlight here is what kind of air filtration or purification should I buy? In order to understand this, we need to understand if you want to capture the pollutant or kill the pollutant. Now, one of these technologies that is playing a very important role when it comes to microbial or virus reduction is HEPA filter, and people have started focusing on air purification with HEPA filter in their houses. That's a good option. But HEPA filters also have medical grades, have different grades. Buy the best medical grade HEPA filter out there, purifier. But again, you need to understand HEPA filter will only capture the air and the particle. It requires a medium of air which needs to be recirculated through the HEPA filter in order to capture it. It will not neutralize or kill the virus, whereas it will capture the PM levels as well. So we need to capture the PM levels, that's good enough. But what about microbial or virus? You need to eliminate it from the air, neutralize it from the air. Now this HEPA is called a passive purification technology, as the air needs to recirculate it through it in order to capture it. When we are neutralizing the virus by rupturing the RNA, DNA of this virus and making it inactive in the air and safe to breathe from the air itself, That is what an active purification technology is. So PHI here, photohydroionization, is an active purification technology that imitates just like what the sun does in the morning. It produces hydrogen peroxide molecules using UV as a source of energy, just like what we have the sun doing in the morning when we get up, and we feel fresh when we go out for a run. So this is the basic difference between an active purification technology, that is the need of the hour, which will neutralize or kill the microbial from the source in the air itself, and does not require any recirculation through the same medium in order to capture the particle.